Hey guys, Dr. Joseph Bogart, chiropractor in Parkland, Florida. I've been practicing about 20 years and I want to share some of my experience with you and what I've seen in relation to car accidents. Okay? So after a car accident, most people worry about things like repairing their car or replacing their car, getting it taken care of. And cars are made out of metal, plastic, things that can be repaired and replaced. Unfortunately, the body is a little different. And so people often focus on the car in a car accident and not their bodies, and usually not until it's too late. When I say too late, I mean possibly months or years down the road, and symptoms have really become a problem because they didn't address them right away. And what kind of problems am I talking about? I'm talking about soft tissue issues. I'm not talking about, if you've got a fractured bone, you need to go to a hospital. I'm talking about soft tissue injuries, and by soft tissue, I mean muscles, ligaments, tendons, discs, nerves, things of that nature that get injured and damaged in a trauma, such as a car accident. Okay, so in a car accident, let's just use a rear end car accident. Oftentimes there's different forces where say you're either stopped and you have to go backwards, and then there's a snapping back effect when the muscles try to protect you and your head pulls forward. And so you've got this stretching of ligaments and tendons that then causes inflammation that can irritate nerves, which can cause discs to tear and shear in certain forces and lines of drive. And when that happens, people oftentimes have symptoms like headaches, neck pain, back pain, shoulder pain, chest pain from the seatbelt, extremities don't work well, knees that bang into the dash. I mean, we see a lot of injuries like that in our practice when people come in and they've been in a car accident. And if they're not addressed properly, they can become significant chronic problems that may haunt them for the rest of their life. Or maybe not for a while, and about 10 years down the road, all of a sudden they're starting to have a lot of issues like chronic headaches. They can't turn their head to one side, or they're getting numbness in their hands, and we find out, yeah, you had a major trauma about 10 years ago and it wasn't properly dealt with. And now they're paying the price then. So the purpose of this video is to educate you and understand that after any type of a trauma, even up to 5 miles an hour or down as low as 5 miles an hour can cause whiplash injuries, stretching, tearing, pulling of ligaments, tendons, muscles, joints, nerves, discs, etc. And it's a good idea to get checked. Doesn't always mean you need care, but it's always good to get checked. And in Florida, you need to get checked within the first 14 days. If you don't get checked within the first 14 days, any insurance coverage that might have been there, they say, no way, we're not treating you and we're not covering you. You can treat with a doctor, we're not going to pay for it. So it's always good to get something documented, checked by a professional. Chiropractor professionally would be great because they're specialized, like myself, in dealing with those type of injuries versus your regular practitioner who doesn't really deal with a lot of musculoskeletal injuries. Get checked right away. Usually within the 14 days is best. And if you need care, get care. If you don't need care, they'll tell you, say, hey man, you're really not messed up. Good, I'm glad you came in. I'm glad we checked you out. Go on about your day, and if you ever need us, we'll call you. So do that, okay? That's my little PSA message about car accidents, chiropractic, and whiplash. I hope you're having a great time, and I look forward to talking to you soon. Get ready for my next video. See you soon. Bye-bye.